Hello, everyone. Hey, this is Dr. Dawn. Welcome to Hands Up with Dr. Dawn, a special series that I've dedicated to mental health and those who are inspired students and leaders of the mental health professions. I'm Dr. Dawn Brown, a double board certified child, adolescent, and adult psychiatrist specializing in ADHD and sports psychiatry. And I'm beyond excited to have you join us here today. It's been a minute since I've been here, so I really do appreciate everyone from joining and a special shout out to my mentees who should be in the virtual space this week, next week, and also separate from the live event. So before we dive in, I want to take a moment to highlight an urgent reality. We are facing severe shortages in mental health professionals, particularly psychiatrists, psychologists, and therapists. And according to recent stats, by the year 2030, the United States is projected to be short around 15,000 psychiatrists alone. And when we look at minority representation, the numbers become even more alarming. Only about 4% of psychiatrists and 5% of psychologists identified as Black or African American, despite the growing need for mental health services in our communities. So, this is why today's conversation is very crucial. And we need to expand the pipeline of mental health professionals, particularly those from minority backgrounds. It is critical that we work together to produce, mentor, and encourage more minority leaders in the mental health space. If we don't, the consequences could be devastating. Entire populations may go untreated, and communities that would benefit from the most culturally competent care might be left out. So, tonight and next 2 days' conversations are about inspiring and expanding the mindset of how mental health care can be practiced. This is why I've invited some amazing colleagues who I also call friends, who are experts in their own specialties and subspecialties. They'll be sharing their journeys into the mental health field, and you too can carve out a path in this essential space. Now, I often get calls, texts, and requests from people curious about my career as a psychiatrist. So I want to share a sidebar to my mentees who are watching. Make sure you take notes and ask questions. And to all who are here with us live, now is the time to get those questions answered. And not just from me, but from this incredible panel of experts who represent a wide range of mental health specialties, including child and adolescent psychiatrists. We also represent adult psychiatrists, sports psychiatrists, ADHD subspecialists, general psychologists, and performance psychologists. So that's a wide span here. Together, we represent a broad spectrum, actually, of mental health expertise and subspecialties. So it is my pleasure to introduce our distinguished guests, Dr. Valdesha Tejan, Dr. Gina Evans Hutnall, and Dr. Josiah Igono. Each of them brings a wealth of knowledge and experience to the table. And I want to just thank them for taking the time out to be here today. All right. Hello, everyone. Thank you so much for
Hello.
joining. I really appreciate it. And I forgot to just share with our audience, please like and share, this broadcast on your platforms. If you know of a student or professional who's wanting to know more about the mental health careers options, please share this with them. And definitely, please, please, please engage as we have this discussion. So thank everyone for coming this evening. And I want to start with you, Dr. Dejan. If you and then Dr. Gina and Dr. Josiah, if you all can just share just a brief intro of the role that you play in the mental health space.
Okay. Well, first of all, Don, I want to thank you for being a trailblazer in this field, for being a change agent, and for having an initiative that's so important for so many students to come. We really do need more pioneers in this field. So I'm just honored to share this space with you. So hello, my name is Valdesha Dejan. I am a board certified psychiatrist who is in private practice, and I specialize in the trauma, PTSD, mood disorders, and I have a specialized niche for professionals in crisis. I knew early on that I wanted to be a psychiatrist. My interest actually started from having a front row seat of witnessing mental health in my own family, two family members in particular, one with schizophrenia and the other who struggled with depression and trauma. And as I witnessed their suffering, I began to try to understand it better and started reading literature on my own. And I really became very invested and very, it really piqued my interest as the more I read. I began to get older. I would have these encounters with strangers and they would share so much about their life story. And I would tell my Mom, is this weird that someone told me all of this stuff about their life and they didn't even know me? And that's when my mom pointed out that I had a spiritual gift, she felt. And I came to realize that it was a personal calling. And that's kind of my journey through. And it's been a very rewarding career.
Thank you, Dr. Jashan. I can say personally, you are my number one psychiatrist that I go to. I mean, how you just explain conditions, how you meet people where they are, just the cultural sensitivity, the explanations, the empathy that you have, is just unheard of. And I just appreciate what you do for our field. So thank you again for being here. Yeah. Dr. Hudnall.
Good evening. Thank you so much for having me. It's always fun when I get to share the space with you and other people who look like myself. So thank you so much for putting us together. I am Dr. Gina Evans Hudnall. I am the owner and operator of Total Wellness Assessment and Counseling Center. I'm a clinical psychologist by training with a specialization in neuropsychology. I'm also an associate professor at Baylor College of Medicine, where I train psychiatry residents in cultural competency by the bedside, in addition to using evidence-based medicine. And I'm a researcher with the Michael E. DeBakey VA. I would say psychology chose me more than I chose it. My actual undergrad is in biology, and I was a pre-med major. And the first semester of my senior year, I remember being over my cat with its insides open and being absolutely miserable, and just really contemplating, do I really want to go on with this path? But I'd already pretty much finished my degree plan. And back then we had what we call resource books. So I went and did what good inquisitive nerds do and went to the library, with my lunch and my coffee and resource books, and just literally flipped through careers until one really touched my spirit. And I knew my passion was always to help people feel better about themselves. And I thought I wanted to do that with the pathway of medicine via plastic surgery. So I decided, well, psychology, I can still help you feel better from the inside out. So I took literally the last two classes of electives I had in psychology my second semester. It had just enough electives to apply to the master's degree in psychology, and I fell in love with it. I had great people along the way who carved out a path for me, and my path just keeps growing. And that's how I got here.
You know, Dr. Gina, I always bring this up and I will always just contribute or basically just share my gratitude for you being an inspiration to psychology. I've learned a lot from you through our shared patients as well. And I'll always be grateful for for you offering your space for me to practice psychiatry as well for free. So thank you. And I think this is something that we should always talk about because again, because there's so few of us and how when we start out and we want to encourage our mentees or students who are along the way that, not only can we share our expertise, but you actually shared your office space with me when I was trying to open up another office. And so thank you so much for being so generous and for all the work that you do, not just with the VA, but with students as well as the clients you serve.
Thank you
Yes.
for that.
Yes. And Dr. Josiah.
Hello, everybody. Just to echo Dr. Dijon and Dr. Hudnall, I just want to say thank you, Dr. Don, for creating this space. I think it's very important. I believe that it is very much necessary. So I'm honored to be here tonight. In regards to my background, uh, I was the kid, the 22-year-old kid, college athlete that said when he graduated, I'm never going back to school. I'm not going. I don't need a master's degree. I'm not going back. And one of the things that I found out very quickly was that I was going to work with athletes. I knew I was going to work with athletes. And my personal mission statement became that I wanted to challenge athletes mentally. I wanted to train them physically, and I wanted to encourage them spiritually. That was my mission statement. And as I started looking around the room, I started noticing that I was the youngest one, and I was the only one who looked like I looked. And so I realized very quickly that I had to go back to school. And so, in terms of my path, I've been a strength coach. I've worked in professional sports as a strength coach, as a psychiatrist, or as a psychology director in professional baseball. I'm now currently a university professor, rather. I oversee a department. We're building a department, a sports psychology department with over 700 athletes and initiatives to serve them in that regard. And so all things athletes and performance, that's the space that I live. And so once again, just honored to be here with you all this evening.
Thank you, Dr. Josiah. We met each other on the speaker circuit, and I just fell in love with you. Just kind of your light, what you bring to the field. And I just never met a Black psychologist who was in sports, who was very engaging with their clients, and how you just describe mental toughness and sports performance, and how you related that to injuries. I mean, there was just so much I learned from you that I had no idea in coming into the field of sports psychiatry. And I know you're very, very humble. I always mention it, but I'm just so proud that you're the one of the few and one of the first, I will say, Black psychologists in the Major League Baseball. And I know you won't say that, but you are. So, I mean, that's just something that we just want to share again with, who we're speaking to, because we want so many of them. We know that there's many areas that we are there, they may still be first, right?
Mhm.
In the field that we practice. And so we just want to just encourage them that they can do it too, just like, we've been able to achieve, the roles that we've been gifted. So thank you. Thank you all for being here again. There are some questions that were given to me beforehand. And while we wait I see some people definitely here in the space. And while we wait to see if there's any questions there, I do want to actually start with a few questions here. The first question you all somewhat hit on, but I think this is a more focused question on a personal answer, looking for from you all. So the first question is, what inspired you, and anyone can answer, what inspired you to choose your specific field of mental health, and how did you know it was the right fit for you? And I know some of you have already captured that answer, but I think the second part of that question, when we work so hard for so many years, go back to school, what did it what told you personally that was the right fit for you all?
I can start. During my residency training, I initially thought I wanted to be a child and adolescent psychiatrist, and then I realized that wasn't the right path for me. But what happened along the way is I would encounter these patients that were refractory to treatment. They would not get better. And I started noticing a pattern. And I said, well, what do all these patients have in common? And the ones that tend to not respond to medications, or sometimes they would come on too many medications at one time to me, and all of them had trauma in their background, pretty significant childhood trauma. And I realized that they were just circling the block. They were just going from doctor to doctor on too many medications. And I really love a challenge. And so I began to study that type of population and learn that they needed something a little bit different. And for that reason, I began to work more specifically with PTSD and trauma. And what I also learned is that medication is not enough. I learned that very early on. And I knew that they needed to address the psychological implications of their illnesses. As a result, I actually have a practice that integrates both psychotherapy, trauma-focused psychotherapy, that is, as well as medication management, or to call pharmacotherapy, because I think you have to administer medications therapeutically. So that's why I prefer the term pharmacotherapy. So that's how I discovered that niche, just from the experience, because it was so rewarding when you can actually see patients who were not responding finally get better.
Wow, that's significant. So, Dr. Val, are you saying that as a psychiatrist that we also do therapy work as well?
Yes, there are several psychiatrists in the field who actually do provide psychotherapy in addition to psychiatry. I don't know if they're as plentiful as people who just do medication management, but we are out there.
Mhm. Thank you. Thanks for making that distinction. Is there anyone on the panel that actually thought about one field and kind of drifted off into another, into our space in mental health? Yeah. Okay. And I know just like you went back to school. Is that correct? You were saying you went back to school. So
Yeah,
what was, uh-huh.
yeah. So
And
oh, go ahead.
oh no, go ahead, please.
No, so you ask a very interesting question. I think it's almost so I'm in the sports cosmos. So I'm dealing with athletes and coaches. And one thing that I have seen, especially, it's interesting, this happened around 2019, 2020, and we all know what happened around 2019, 2020. Um, it was sports by and large was not talking about mental health. It was sports performance, the execute performance, the execution of a task or function. And then all of a sudden that was taken away from us at large. And now we have mental health. So we were, those of us in the performance space, we had to lead. We had to lead in ways that we never thought we needed to before as it relates to mental health. I remember being on a Zoom call when the tragic George Floyd incidents took place, and it was all of the Black players, scouts, coaches in the organization on a Zoom call because there had to be some type of grieving process that we had no idea how to to navigate because we've never seen something like this before. So to your question, it wasn't necessarily like, hey, I wanted to do this, but I went here. It was, we had to address this. We had to stand up. We had to arm ourselves with the information, tools, resources, and other professionals to help the people that we serve. So I thought that was very interesting in our space during that time.
Yes. And anybody can answer. This is not just one direct. I mean, if you all have something you want to share, please feel free. Okay. Do you think that what was the challenge for you to be able to do that as a Black male and addressing this with others? I mean, I know that could have been tough for you because I know in our program, we had to have our own therapist, not just to talk about our clinical cases, but also to handle if we had some mental health concerns or if we were affected by societal issues or challenges in order to be the best that we could be for our own clients or patients.
Did you want me to answer that, or do you want me to open?
Yes, anyone. This is just a open conversation. I mean, we're just gonna be real tonight. You know what I'm saying? Because our field's not always. I mean, it can be challenging, right? It's not it's not all glory here. Well, I'll answer. I'll start. For me, it was very difficult. I actually had to take a couple of days off when when that moment happened, because I was actually in the midst of treating athletes as well, but also having my own private practice, and it just became so overwhelming for me because all my patients were either triggered, so their anxiety was off the roof, they weren't sleeping, they weren't eating. Meaning the athletes, this bubble phenomenon, they didn't know what to do with that, and they weren't, engaged with their family. They just seen, someone murdered that just looked just like them. and and talk about not just George Floyd, but there were other murders that happened around that time. I mean, and so it was just a lot of mental health challenges that were just taking place, and that actually just really, significantly impacted me spiritually, emotionally, all these things. And it became so overwhelming. I had to kind of take a couple of days off just from doing what I did in order to seek my own help and trying to figure things out. So I know you're talking about you had to, and these are things that are not pre-written. I mean, this was something we've never, lived through. And mental health was at the forefront, right? That resulted in all
Yeah.
these things happening.
Oh, Dr. Gina, go ahead.
No, it's okay. So during that time, um, it was a couple of things that were unique about my employment situations. I'm the only African American associate professor in my department, and I'm used to being spaces where I'm one or I'm the only. And if we're going to be honest, there's always a presentation face, right? That we have on in spaces when we are the one or the only. Um, and during that time, my presentation face came off because I was still there to be professional, but I was also there to be honest with you and not here to make you feel better. And not here to, I'm not here to say words to make you feel better. You feel how you feel, and you should feel how you feel sometimes. And that's a learning experience. And so I think for me, it was one of those moments of being able to have conversations that we probably wouldn't have had in less curated words than we would have had them before.
Mm-hmm.
And so it was a different feel in our department during that time. But it ended up being, it ended up being a good thing. And I think it was one of those times where other people got to see the face that doesn't always smile, and have the conversations that's not always with a smile. So it was a moment where I got to be direct, and then I think I kind of never went back from that moment. Just still saying, there's always a way that you operate in spaces, but then it's now at a place, even post George Floyd, where we can have some direct, honest conversations. And I think that's also a result of, and I'm honest with myself, because I've had these conversations with others in my department who may not necessarily have been there as long. I'm also very clear that because some of that was easy for me to do because of my position there and how long I had been there.
Mm-hmm.
So I fully acknowledge that as well. But I think it was easy for those coming behind me to see that these conversations can be had. And it gave them a little bit of the safe comfort to say, you don't always have to smile, and you don't always have to curate your words.
Yes. Do you think that's changed your stance when you actually engage with your clients? Because I know in my program, we were taught not to share personal information, even though it could be potentially helpful to our patients. I think our field has evolved into something different. I think we've actually created a field or a different kind of avenue to reach the patients that we're seeing because everyone has different needs. Do you think that moment changed for you? Changed the way you engage with clients?
I think I've always part of one of the things that we all know kind of what our superpower is, right? And one of my superpowers is that I'm very relatable. And so I've always felt comfortable sharing certain things for therapeutic reasons with my clients so that they understand you're not the only one. And so that they can feel that there is someone who understands you and gets you. So I think I've kind of always done that as long as it was therapeutically like beneficial for them.
Mm-hmm.
I think for me, as I've gone on in this field, I think I probably share a little bit less, only because the human nature of people I've seen. And so sometimes it dictates sharing a little bit less.
Mm-hmm. Thank you for sharing that. I want to go into another question, unless anyone else has anything to add. Um, Question is, why do you think there are not enough Black doctors? So when I say doctors, psychiatrists, psychologists specializing in mental health, and how can we encourage more diversity in this profession? Val, you're on mute. Can't hear you. Yeah. Yeah. Oh,
Mm-mm.
no, not sure. Okay. Let's see if we can do. I'm gonna bring you in and bring you back out and see if we can see here. Bring you in. All right. You- No, can't hear you. I don't know. Not sure. You can see your beautiful face. We just can't hear you. Okay, no problem. No problem. Does anyone want to take a stab at that? I think it's a confounded question. I think coming from Flint, Michigan, and brought up by educators, even educators. And my dad would say this too. I mean, when I told him that I wanted to be a neurosurgeon, and that's kind of where I started off, that was known. Ben Carson, Alexa candidate, Keith Black. I mean, we had examples of neurosurgeon, even though we're few. When I mentioned psychiatrists, I didn't know any Black psychiatrists, not one. Not one. And I found, like, similar to, I think what Val mentioned, there was a gift and people trusting me early, sharing their stories. I had no idea what a lot of these people, I didn't know them before they were sharing with me. And so I just realized that was a gift that God had given me. And I thought about, well, I love people, and I didn't want to be in the operating room for 18 hours, and I wanted a life. So I just kind of grown towards psychiatry, and I found I was good at it as well. So I think that one of the things I want to stop and share here is that you find a profession that you're good at and you enjoy. It's great. You're good at it and you enjoy it. It's great. And I know there's an adage out here that says it's like you're not working, but no, you are working, okay? Because it's about balance as well. But you want to make sure that you're good at it and you enjoy it. I think you'd be ideal and you can really expand your horizon there. But when I mentioned psychiatry, in my community, a lot of people shunned that because they had their ideal of what psychiatry was: a white male who had somebody on the couch or somebody in a straitjacket, someone who was actually, losing their mind and needed to be medicated or restrained. I mean, there were just so many different visions and versions of what psychiatrists do. And so I really had to start educating people of how we could be helpful, not harmful, and how our field has evolved to be helpful and not harmful, especially to the Black community, because the American Psychiatric Association is the oldest organized organization in the United States, which didn't treat Black folks well. Okay, so we had to get, kind of work through that, and also just, educate people that's okay to have conversations with us. And that doesn't mean that you're coming to me to figure out what medicines you're taking, but you're coming to me to identify what you need in order to better your mental health, because I don't prescribe medicines to everybody. So if it's not necessarily clinically warranted or recommended. So I just had to kind of break it down to where, their people's ideology I was, and make sure those myths were broken. But I think that's also led to people not going to our field.
Yeah.
Do we talk about mental health in our families? Do we talk about mental health? I mean, in our age group, I think a lot of students now are having those conversations, thankfully. But I don't know what your experiences have been. I mean,
I would love to answer that question, but Dr. Val just came on, and I want to see if she if she's back.
Yes. Oh no, we can't hear you. Are you not on Bluetooth or speaker, huh? Okay. And now you can also join from phone too. I can text you the link. Okay. Okay. Sorry about that. Hey, technology's good when it works. Yes.
Yeah.
And while we're waiting for her, what were you saying? You're gonna say something just now?
Yeah, so your question is a great question. Why do we not see a lot of Black folks in this profession? And I would say there's a couple of reasons. Number one is obviously stigma, right? We don't people in general, I would say, when they look at psychology, when they look at psychiatry, when they hear those words, it automatically goes to, okay, what's wrong with you? What's wrong with him? What's wrong with her? Right? Coming from the sports side of things, anytime you mention those words, this player has a problem. Go fix this person. Well, we're dealing with people, not machines. You know what I'm saying? When I was a college athlete, there was no such thing as sports psychology. Like, I didn't know what sports psychology was. My mental skills, my mental performance training was me praying, to God for a great game and studying my playbook. There was no one I didn't have a Dr. Don that I could go to and talk to. Like, I didn't know what that was. And so I think that's one area. I think another area, as you said, Dr. Don, is people need to be educated. They have to. You don't know what you don't know. People have to be educated. And when I talk to a lot of graduate students and they say, I want to get into sports psychology, I want to do this, I want to do that, and the third, I say, okay. And I would love to hear from you all here this evening. But what I tell them is this: I said, when you look at psychology, when you look at psychiatry, especially sport, from a psychology standpoint, there are three main. If you look at a triangle, right, there are three main buckets. I tell them. The first one is the authorship and the academians, the content creators. These are the individuals who make our profession known. These are the individuals who are they're not even psychologists. They're not psychiatrists, but you see them on social media. You see them on YouTube. You see them on Instagram. You see their videos. You see their voiceovers, but they're making what we do known, right? And there are many people of color, many people who don't necessarily look like the status quo that are contributing to these areas, even though we don't call it psychiatry or psychology, right? You have the clinical people, same thing. These are the individuals who are diagnosing and prescribing, like you ladies here this evening, and we need those people. On the sports side of things, many athletes, as we know what the numbers are in professional sports and collegiate sports. We know what the numbers are, right? In terms of representation, it's skewed. It's skewed. But we need those clinical people as well. And then the other end of that triangle. So you have the authorship, the content creating people, the people in academia, those who are making our profession known. You have your clinical people, and then you have your performance people. These are the individuals who are in the lines within their athletes within the lines, helping them to be able to regulate arousal, to be able to deal with perfectionism, confidence, focus, all these things. And there are many people who are not necessarily college educated or have the licensure and degrees and whatnot, but they are very diverse and they're contributing to the space. But at the highest level, to your point, Dr. Don, there you don't see a lot of representation. It is evolving. One of the things I've seen is the fastest, and I'd love to hear from you ladies, the fastest growing segment of this trade craft are women. All the calls that I get for sports, they're all women. You know what I'm saying? And so I think that we have to acknowledge that it is evolving, and it looks different from what we have been trained to look at it as. It's different. We don't we can't even use the same language anymore because it's not the same. So I'll stop there. Those are my thoughts, my cursory thoughts when you asked that question.
That was good. I like how you broke that down, and you're exactly right. And I don't think I didn't, my mindset didn't even explore all the areas that you covered with the triangle. You're exactly right. But Val, what were you going to contribute? I mean, what were you going to say about this as far
Oh,
as
I think it was
lack of
already
minorities?
mentioned. I think stigma plays a huge role, to echo what has already been stated. Um, if we don't even believe in doing that for ourselves, it's hard for people to want to go into that field. And one of the things I even noticed, even within residency as psychiatrists in training, we were stigmatized by the other fields.
Yeah.
So, other
Yeah.
specialty areas would make jokes, oh, here comes the psychiatrist. And, so that stigma of the patients were displaced onto us as clinicians. So that was an interesting piece that I would notice. And so if you're a medical student trying to decide what field you want to go in, and you're noticing, your resident who's teaching you get disrespected like that, it is certainly a deterrent to say, "Oh, let me sign up for this." And then I think there's another piece of financial barriers too, with just not having enough doctors in general. And then psychiatry being perceived, which we're turning that's not true, but it's being perceived as one of the lower ranking, or lower tier salaries, which you can make it very profitable in the field. So I think that's also another issue, is that people perceive that you're not going to make a lot of money if you're a psychiatrist.
Yes, very excellent questions and very insightful. I do remember that a part of my training too, both fellowship and residency. You're exactly right. You're exactly right. Dr. Gina, did you have anything you want to add? Because I wanted to um, see how we can overcome this. And one of the things, and Dr. Gina, I know you probably will, this is kind of the question for you too. How can we overcome? How can we encourage minority students that, not just educate and mentor, but for example, show them how they can be a profitable practice. Show them they don't have to necessarily go one route. I mean, if they want to do private practice or they want to do telepsychiatry or telepsychology, I mean, I think that that's something that we definitely need to talk about because I don't see that enough talked of, I see it when people are needing help. I'm not seeing it for the professionals that we're needing that we're about to lack in 2030. Because my concern is everyone that comes to me, well, do you have a black therapist I can see? Or do you have a black doctor that I know you don't treat this, but is there another black doctor that treats this, in mental health, like schizophrenia or bipolar? I get those questions all the time. And if I don't have anyone to refer to, I'm concerned about that. And so, I think that some of these points you are bringing up have been barriers to people even being interested because the lack of knowledge or the lack of mentorship and understanding how this could be profitable, how they will like this field if they're gifted at it. Um, I don't know if you have any thoughts on those points.
I think we have to do a better job really promoting the return on investment, because it takes, it takes by the time you get all the way through school, from undergrad to on, you will have been in school 7, 9, 10 years easily. So when you start to say it'll take 7, 9 or 10 years, and then, you'll be Dr. such and such. And then people are saying, well, why would I sign up for that when I can go 4 years, get an architect degree and come out making 6 figures, right? Or I can get a law degree, which is just 3 more years afterwards, and make a good salary. So I think doing a better promotion of return on investment, which is the monetization and the business aspect of it. Because I don't know about anybody else, but I never had a business course in my program. My program was, either your career path is going to be a counseling center, teacher, researcher, private practice. That's it. And private practice was talked about the very least, if anything. And that was talked about because you knew somebody who was a professor who also had a private practice, but it wasn't woven into any academic course. And so I think really we just have to do a better job of talking about the business aspect of what we do and how the return on investment for the business aspect, you know, can be just as rewarding as these other careers. And how even you can make the business aspect of it start working for you even before you are completely done with your degree. So I think just really doing a good job of making our field as appear to be as lucrative as others. But then I also think it takes for people to know us personally, because people know what they see on TV, and that's not us. But I think when people get to interact with Black doctors, it changes their view and changes their skew, and it changes their understanding, and they're more likely to go into it. I'll give you an example. I was the first in my immediate family. We have a psychiatrist in our family, in the more distant family, but in our immediate family, I was the first to get my doctorate. Well, shameless plug, my baby brother is finishing up his internship year, and he's about to be the next psychologist in the family. But he saw his sister going through it, so he understood what it was, and he got to see it. So now he's able to do it, and hopefully it can be something that continues. So you also just have to, you got to know us intimately too, to understand what we do to make it exciting for you to want to do.
It's a very great point. Very great point. Congratulations to your brother as well. I know you're
Thank
very proud of him. Yes. And you're just such a great inspiration. I mean, how could he not want to follow your footsteps? You know, that hits close to me as well. You know, my brother's a forensic psychiatrist. I thought he was going to be a pediatrician. I was the last to find out he was going to psychiatry. I still to this day don't know why I was the last, but later on, you know, I do know. I mean, you know, he saw, like you're saying, firsthand what it could look like and what it can envision. I was hoping we would do private practice, but he found his love for forensics. So even though, you know, it's a different subspecialty in the field, I was proud to know that I probably, you know, my decision to pursue psychiatry somewhat contributes to that, so that other not people that he serves can benefit from him being a forensic psychiatrist. And I think that's a good point, because I do encourage us as Black leaders in mental health to have mentors. Mentorship is so important, you know, and I know we have busy lives, and it's very difficult and hard. And I say it easy. I know I'm not married. I don't have children. All of you all are married with children. And so, you know, but I do feel we need our space to mentor, if it's just taking on, you know, a student here, a medical student there, maybe speaking to certain students in education. You know, there has to be some degree of being able to have access to us. And so whatever that looks like for you, that's important, right? So that you know, the students can, you know, definitely have that experience, because I think that is really a solid way we're going to be able to reach these students, so they can really identify what it's like to do what we do. Yeah, yeah. Has there been any what have been the challenges? Let me actually ask this question. What do you think are the necessary traits to have in order to go into mental health? That's actually a question that's been asked a couple of different ways. And I think that one of the students that I know asked a question is concerned that they're not gifted to be a psychiatrist. And so I wanted to get an idea from you all. What do you think are essential tools or traits that you need in order to explore this field or develop, I guess?
Well, I can start on that. I do think to some degree it's important, you know, which subset of the field that you're going into, that somewhat matters, because there are some things you may need in clinical psychology or psychiatry that you may not have to have as much in research. Or let's say you want to work with insurance companies and just review data. So, but in my practice, in private practice, and as a therapist as well as a psychiatrist, I would say empathy is very important, compassion, and good interpersonal skills. The empathy and compassion causes you to engage people in a way that they don't feel like you're judging them when they're disclosing these secrets that sometimes they don't even tell their own family members or best friends. And then the interpersonal skills provides you with the skills to be able to deliver that and communicate feedback in a way that's productive and constructive, so you don't damage them even more as you're giving the feedback. And I would say that's a skill set we can see within our own family and friends. You can say, "Ooh, that was a little rough the way you gave that feedback to me." We have that in our own families and friendships. So I feel like as a psychiatrist and as a psychotherapist, those are very, very pivotal skills.
I love that, Val. That's awesome. Especially those interpersonal skills, because um, a lot of things what we do, we actually visualize, right? The nonverbal behaviors as well. And so, you're trying to make a clinical decision, and you're not, it's hard to do that just by counting on people sharing. You have to kind of understand and, nonverbal behavior that may lead to a difficult conversation to be had, so it can give you an accurate assessment. Yeah. So that's so important. It's really good. Okay. Um, Moving on, because I know there's a number of questions here. How do you all manage work-life balance? I said that you all have families and you have your own personal things that you like to do. But particularly, especially in an emotionally demanding field like psychiatry or psychology. And what self-care strategies do you recommend for mental health professionals as someone that's interested in going to this field?
I could, oh, did you want to go, Dr. Gina?
Go ahead.
Okay. I was going to say, when you get to a certain level of just responsibility, right? I know that everybody on this call has a high level of responsibility. I may be a minority in this conversation or in this opinion, but I do not believe that there is such thing as balance, because at the end of the day, when you start looking at balance is typically equal parts, right? And we love our family, but we don't get to spend 8 hours with them every single day. We're usually spending 8 to 10 plus hours at our job with our colleagues. And so when it comes to balance does not become a function of equal parts anymore. It becomes a function of intentionality. And so you have to make time for what is important. And so if it's my relationship with my wife or my children, I need to prioritize that, and I need to make that I need to be fully engaged when I'm with them for that 15 to 20 minutes, 30 minutes before they go off to school. And then when I come back, I'm fully engaged with them. When I am there at home and my laptop is shut, my phone is off, and I'm asking them what they did for their day. Because when you look at balance as equal parts, there's very few people that can say that, yeah, I spend 8 hours with my loved ones. I spend 8 hours. That doesn't happen. So now it's a function of intentionality. And so a saying that I've always loved, and I will share here tonight, is that if your output is greater than your intake, then your upkeep will be your downfall. If we are continuing pouring out, giving, counseling, therapy, ministering, we are continually pouring out of the goodness of our heart because we love people so much and we love our profession so much. But very few times we're not putting enough back in. And what happens is when you're not putting enough back in, you are in essence doggy paddling in the middle of the ocean. And so when your output is greater than your intake, your upkeep will be your downfall. For everyone on this call, our input, the way we fill our buckets back up, is different. For some of us, it might be church. It might be a walk on the beach. It might be working out, exercise. It might be reading. I don't know what it is for you, but you better make sure that you're putting stuff in so that when it's time for you to be intentionally present, that you can, so that your life is balanced and that you have a sound mind.
Amen. Why you take me to church tonight? I love that. And I'm gonna do a little plug here, Dr. Josiah. You have to get his book on the pieces.
I love it.
Listen, we gotta do more of this, right? He's an author of this book, and that exact quote is in this book. And it matters. What you just said matters, and that is so important. And I think what I took from that is that it's all different for all of us. It's different for all of us. And so that is just important that you know what that is for yourself and your routine with that, because emotionally this is draining. This can be a very draining career. You look at surgeons and you look at other medical specialties who have to see their patients, touch them, feel them, whatever. And sometimes we see ours on the screen, but it's just as emotionally draining for us as it is for someone who goes into the office. And so, I think that is so important that what you just said. Yeah, definitely. Please, please, you all remember that, especially the students here on the call, for sure. Dr. Gina, is there something you wanted to add to that?
I think it's boundaries. It's managing the most expensive currency you have well, which is your time. And I think it's being okay to say no. When I close my office door, whatever issue was for the day is left in that office. And then I'm on to the next place, the next family time, the next whatever. So just making sure that you keep good boundaries, and you be focused and intentional about what we do, such as, like, for example, the biggest misnomer is that multitasking is effective. It actually is not. It's just delaying, like it just takes longer for you to do the task and it's not your best work. So just making sure that the boundary of this protected time is to be dialed in with my kids, and the world will wait. I don't read text messages. I don't answer the email. I don't engage in conversations with people while I'm on my phone or my head down, because I'm not dialed into you and I'm not giving you my full attention and my full time. So just making sure that whatever boundaries that you have for yourself, that you unapologetically keep those boundaries, and that you stay focused on whatever you're doing at that time or whoever you're with at that time. Because the one thing that you can never replace in life is your time. I can replace money. I can replace items. I cannot replace my time. So I make sure I spend my time dialed into whoever I'm with or whatever particular thing I'm working on, and I spend it wisely.
Amen, sis. Took me back to church. That's so important.
Amen.
And I want to add that it's okay to have a therapist. I do. I think that when you're in a career of mental health and you're actually dealing with emotions and behaviors and all these other variations of mental health, I mean, it's important that, part of that pouring back to yourself. I mean, I know it looks different for everybody, but it's also scientifically evident that therapy can also help you. And a lot of things that we may manage or help treat, maybe some of the things we're dealing with, and how we can, you know, make sure we know our own implicit biases and make sure we know, our own limitations. And if we're having problems saying no, how can we change that? So I think it's very important in the field, and that has been preached in all of my programs, is that it's important you have your own therapist. It's so important. And to practice self-care. That's why I'm so huge on that. You always hear me talk about that because it is. And
Yeah.
so, it's okay. And this is what you're teaching, and also, encouraging your patients to do as well. So you have to do it for yourself. You have to believe in what you're also giving. Yeah.
I think from a practical standpoint too, it's like a lot of times people will wait till they're tired to go on vacation,
Come
or
on.
they'll wait until it's, almost half of their year to take PTO, so I think I've learned to structure in the self-care. So it's interwoven in, even though I know I'm busy, it's a place setting for me. So a massage every 3 months or every month, or a mani-pedi, it's, put in that way. One thing I've also done is I don't work on Fridays anymore, and protecting that time as a wellness day has been extremely beneficial for me, especially in the light of the fact that I treat patients with trauma. So, having that day for myself has been great. And private practice does allow for that flexibility, for you to manage your time in that way.
Amen. That's so important, Dr. Val. Thank you for sharing that. I actually have a question I want to spin off of that, and I know we're almost out of time here. This has just been so insightful, and thank you for the community for sharing and joining. I see everyone that's come and gone and come back, so I really do appreciate you all being here. As a minority student who has struggled with their own mental health, what advice would you give to ensure a successful, meaningful career in this field? Um, and I know I can speak that because I have a mental illness called ADHD. And so it's interesting because it actually led me to want to understand ADHD more because I thought that that would be a barrier to me being a good psychiatrist. I mean, you talking about not focusing, forgetfulness, being late. I mean, who would want to see a psychiatrist with all those things, right? All of those possibilities. And so I was really concerned. And I actually started by first confirming with three people I had this condition, and then, out of my own resolve and I acceptance, I actually started learning more about it, and I was just determined to become an expert in the field that to help other people. And so, having a mental illness is doesn't break you. um, Actually having a mental illness can be something that you are an inspiration for other people, especially in this field. I tag myself the MD with ADHD because I want students, I want children, I want adults to understand that you can have a mental illness and do this and be a doctor, for example, be a lawyer, be a judge, high professions, and still do well. And so, but I think it's also just a validation that mental illness is not a bad thing. It's not a bad word. And that's why I always talk about it. You always hear mental health, condition, these subtle words, but mental illness is okay. Just like any other type of diabetes or hypertension, we normalize that. We have to start normalizing this so that people can really get the help that they need, especially doctors. We have a really significant high, just like the question of the student that proposed here, we have a significantly elevation of high mental illnesses within our own culture, being physicians and psychologists, clinicians. And so I think it is important to address this because a lot of doctors are just being silent about their own mental health. But that's just kind of one answer or one piece of it. Do you all have anything that you want to share for this student who's struggling with the mental illness and how they could feel validated in becoming a mental health specialist?
I always tell people, God made you exactly the way He wanted you to be. He makes no mistakes. He makes no flaws. So you are exactly where you need to be. Know thyself first. Deal with whatever it is you need to deal with, but understand that you can be successful in anything you want to do because nothing occurs by happenstance.
Beautiful. It's beautiful.
Don, I think you highlighted something that's important is to do maintenance psychotherapy. It's to you can go in and out whenever you need it and to always have that there and to be vigilant about and intentional about your own mental health. Heal the healer, right? So to be intentional, to get the help you need for you so that you feel stable. I think supervision is a very important tool. So if you're always meeting with a supervisor, that supervisor can help you to reflect on challenging cases that may touch you at the core of something that's bothering you or maybe feel close to home. They can also be someone that's observant in a way that they can give you feedback if you're not always noticing when you're declining, so you can use the supervisor in that way to guide you and say, maybe it's time to go check back in with your therapist or your psychiatrist. But to see the beauty and the pain of that, and that you have, as this student is asking, you have this connection to the patient in a way that other people may not, because you have your personal journey, and to see that as a strength that will help you to be able to guide the patients through.
Amen.
Yeah. And I would just add, just to dovetail with what Dr. Gina and Dr. Dijon has already said, there's an old proverb that I love. It says, where there's no counsel, the people fall, right? But in a multitude of counselors, there is safety. And we are created for a connection. We cannot do it alone. I don't have the gifts that you had, because if I had the gifts that you had, one of us wouldn't be necessary. You know what I'm saying? And so when you have that safety and that multitude of counselors, those people that we can look up to and we can ask questions to and we can seek counsel from, that's the ticket right there. That's the ticket. We weren't made to do it alone. We were made to do it together. So that I just love the fact, Dr. Dawn, that you're having this call and you're providing a platform for these students and these mentees to be able to listen to those who are already doing it. And hopefully, we have been an inspiration to them as well.
Yes, most definitely. I know you've been inspiration to me. I want to respect your time. I thought that was just a great segue of just going into any last minute advice or comments that you have for a student who is interested in our field, who's been inspired by each of your stories tonight. Thank you for sharing your roles, your professions, your accomplishments. Any advice for them?
Be persistent. Be persistent. Be resilient. Um, nothing, nothing easy is going to be effective. So there will be stumbles along the way, but stay the course. Um, and just have this be in your heart. Be here for the right reasons.
Good. All of those are good.
I would say seek mentorship at all costs.
Yeah.
Always seek mentorship. Don't be afraid to make that call. I've had people that don't even know me reach out through email and say, will you mentor me? And most of us are willing and happy to serve in that role. So always create that community of mentors.
I would say, as Dr. Gina said earlier, 5, 6, 7, 8, 9, 10 years is going to pass by whether you like it or not. So if you like what you're doing, if you like it, if you love it, you can do it twice on Sundays as it relates to mental health, psychology, psychiatry, then pursue it, because we need you. We need you in the field, so that's what I would say.
Thank you so very much, Dr. Gina Hudnall, Dr. Gina Evans Hudnall, Dr. Valdeja Dijon, and Dr. Josiah Iguno. Thank you so much for joining me tonight. I really do appreciate all the insight that you've given to our community. You just been such true inspiration to me, and I knew you would be a fabulous inspiration for other people that are listening to your voice right now or will catch us on the replay. So thank you again for being here. I appreciate each and all of you. Thank you.
Thank you for having us.
Thank you. And I want to actually just share with you all. I hope that you've been touched by this conversation this evening. I appreciate again for all the people that have just notified that you're here. Please share this information. I saw a lot of the psychiatry mentors and leaders in here that kind of came in as well. Please share. This is an incredible discussion. And again, I just want to thank our amazing panel experts for taking the time to share their journeys and insights. And thank you for your time. I appreciate your dedication to our field. I appreciate the commitment to the future of mental health leaders. And last but certainly not least, I forgot to tell the panelists, please send a big thank you to your families for sharing some of your time with us this evening. To the audience, I hope that you found this inspiring and informative as I did. And before we wrap up, I want to remind you to mark your calendars for our second segment next week on October 22nd at 6:30 p.m. Central Standard Time. We'll have a new set of panelists with more valuable information and advice. So make sure you join us and make sure you put this on your calendar. Mark your calendars, okay? But in the meantime, keep this conversation going. Share, ask questions, share what you learned, but most importantly, stay engaged. Remember, mental health field needs you. Whether you're a student, a parent of a student, a professional, there's a place for you in this space. So thank you again for tuning in tonight on Live with Dr. Dawn, and I look forward to seeing you all next week. God bless you and your families. Good night.
Click on Zombie Apocalypse.